Hello, I am Dr. Sangeetha. How can we improve the quality of eggs? Of course, we cannot change the genetic chromosomal composition. Definitely, we can improve the quality of the eggs with certain lifestyle changes. When the woman is free of stress, definitely her eggs will be healthy. Anything under stress will be abnormal. So, we always advise the woman or the couple when they are going in for any treatment like IUI or IVF, the previous few months they should be very stress free. They have to manage their lifestyle. They can't tell that we cannot avoid stress. They can work. It has nothing to do with work, but you should not take stress. And they have to make little dietary changes. You have to avoid all unhealthy diet and you have to include more nutritious diet. If sometimes they have to undergo weight loss, they'll be under weight loss regime. So dietitian plays a very important role. Lifestyle changes, little bit of exercise, not too much of exercise. We have seen patients going in for gym, going in for swimming, going in for marathons, everything done every day. So again, that might, the too much is also too bad. And along with that, we'll be supplementing with some prenatal vitamins, which are essential for the quality of the egg and which might prevent some complications in the fetus. So along with this, we advise antioxidant therapy so that the eggs, the stress induced on these quality of eggs can be sometimes reverted back. So yes, you don't have to worry. You have to just visit a consultant before planning your pregnancy and get required advice and follow it carefully. Pre-implantation genetic diagnosis sometimes is indicated in couple who have a known genetic disease, some familial inherited disorder, and if both the couple carry a recessive gene. And there are so many indications. Along with that, we advise for older couple who are undergoing IVF with repeated failures, repeated implantation failure, or recurrent miscarriages can also undergo PGD. So why we have to test? I already told. We have to just select a good embryo which does not contain the abnormal gene which is passed on in their family or from the parents. So there is combination happening when during formation of eggs and sperms, and we have to select a particular embryo which is devoid of this genetic problem, which is devoid of this abnormal gene. So we can test the chromosomes, genes, specific genes with different technologies, FISH or PCR, and we can give the report like whether the couple or the baby contains that, the embryo contains this particular genetic abnormality or not, whether the chromosomal composition is normal or not. So many things can be derived. So for this, the couple have to undergo IVF. The embryo formed is cultured and we can do the PGD on day 3 or day 5 embryos, and day 5 embryos, the blastocyst biopsy is better and it gives better result, and we always prefer to do day 5 embryo biopsy like blastocyst biopsy, and after that the PGD is done and we can look for aneuploidies or genetic abnormalities, and depending on the result we can just advise the treatment for the couple, and we can select a normal embryo, normal euploid embryo for transfer.